16,000 children under 5 still die every day, mostly from preventable causes such as diarrhea, malaria, neonatal infection, pneumonia, malnutrition, and AIDS. The sub-Saharan African region, specifically, consists of nations with the highest child mortality rates in the world. In this region, 1 in 9 children die before the age of 5. For instance, an Ethiopian child is 30 times more likely to die by his or her 5th birthday than a child in Western Europe. Why is this? The Millennium Development Goal number 4 intended to reduce child mortality by 2/3 in 2015. Though the goal wasn't reached, significant efforts were made. Lack of infrastructure is one of the main causes of this issue. In the absence of adequate doctors, accessible facilities, and medicine, residents of sub-Saharan Africa are exposed to diseases and infections, which could be eradicated or treated with basic preventative medical care. Another is the presence of corrupt governments, which results in billions of dollars lost in monetary aid that could direct a nation toward development and infrastructure. Of the 10 countries considered most corrupt in the world, 6 are in sub-Saharan Africa. Some solutions to child mortality are less obvious than others, but still attainable. It's not that we don't have solutions, particularly concerning health-related issues. We do have solutions. Developing a vitamin supplement to put in staple foods could be most effective in reducing child mortality. This supplement is not only cost-effective, but would also add nutrients to help prevent malnutrition-related illnesses. Other solutions would be educating families about sanitation and hygiene, providing immunizations, having access to clean water, and encouraging exclusive breastfeeding, which means not feeding an infant with any formula powder solutions. But because of corruption in many countries, we are hindered from attaining these goals. Years of civil war in Liberia have resulted in a turbulent economy, destruction of resources, lack of education, and political instability. It is very difficult to bring in aid, implement programs, and track progress because statistics are not consistently being recorded. Organizations such as UNICEF are intervening by improving family care practices, increasing access to improved water and sanitation, and responding rapidly to emergencies. The World Bank has also put in funds to facilitate the development of community nutrition and early childhood programs. As we've seen, this can be effective. In Ghana, under 5 mortality rates fell from 111 to 80 per 1,000 live births between 2003 and 2008 due to improved maternal and child health care. Additionally, immunization coverage improved from 69% to 79%. The way to tackle this issue is to communicate our concerns to the powers of these struggling nations while continuing to provide assistance. As we've seen, child mortality is a problem that takes willpower to combat. Since implemented, child mortality has reduced significantly, but the goal hasn't been reached. If we can take an active role in working towards the solution, child mortality will not be an issue for generations to come.